stitch a blanket.
Brenda Duncan has spent a lot of time in CT machines like this one ever since she developed a cough that just wouldn't go away.
I wasn't able to keep conversation going without a cough, and then wasn't able to keep my breath. It would totally take my breath away.
Brenda's scans showed a concerning problem, a slowly growing spot on her left lung.
Shock. Never a smoker, right?
In fact, though, 20% of women who develop lung cancer have never smoked. Brenda had stage 2 cancer that needed to be removed.
We removed the lower lobe on the left side, which is about 50% of the left lung, so quite a bit.
At University of Missouri Healthcare, Dr. Jussuf Kaifi performed the minimally invasive robotic surgery using a device like this one.
The recovery is much faster for patients because you don't have the rib spreading and the large incision, so patients recover real fast. They can leave the hospital within 1 to 3 days.
Within months, Brenda could walk without wheezing. She wanted to say thank you to the man she believes saved her life, sewing this quilt in Dr. Kaifi's favorite color.
The center is supposed to be representative of love, right? I wanted to make him something to show him that I appreciated the time that he spent with me as a patient, because I think that he went above and beyond.
Her gratefulness evident in every stitch. From the University of Missouri, I'm Teresa Snow.